Hello, this is Malachi Bishop with the Rehab Counseling Program at the University of Kentucky, and this is Rehab Counseling 650, Theories and Techniques 1. And today we are going to be talking about two theories, the existential counseling theory and the Gestalt theory. We're covering these both today, as we'll talk about in a minute, in the same lecture because there are quite a few conceptual overlaps and similar ideas, and so it just makes sense to talk about them both at the same time, as I think you'll see. Before we get into that, a couple of quotes I like that are related to this idea of the theory we're going to talk about first, which is the existential theory. Live your own life, for you will die your own death. The idea there we'll be talking about today of the fact that we are all, the perspective, I should say, that we are all alone in this world, and important idea in the existential theory, we'll be talking about that. And then Oliver Wendell Holmes, a man may fulfill the object of his existence by asking a question he cannot answer and attempting a task he cannot achieve. So the common ideas that we will see in both existential and Gestalt theory today. Ideas we'll be talking about that the crossover into both include the idea of meaning and searching for meaning in our lives, the idea of potential. We'll be talking a lot about freedom and responsibility and the anxiety that is associated with both, the idea of holism, the concept we've talked about before of phenomenology, and immediacy and authenticity, living an authentic life, and being using immediacy and authenticity in the counseling relationship. So, moving into existential counseling theory. Existentialism is defined as a body of thought based on the philosophical analysis. I'm going to keep going with that one. That's what I get for reading. The philosophical analysis of existence. So we're thinking about existence and the affirmation of the freedom and responsibility of the individual. So freedom and responsibility. Existential therapy is basically applying the concerns and the philosophical approach of existentialism in the counseling process. And as we'll see, there are several people who are associated with this application that we'll talk about. We're not going to talk about the lives of the individuals in the to the extent that we have been doing. Important point to understand that existential therapy is not a separate school of therapy or a clearly defined model of counseling with a specific set of techniques. There are some techniques that we'll talk about associated with this model, but it's more sort of an overlying perspective that can be integrated and frequently is integrated into counseling, personal counseling theory or a counseling perspective. So a few key ideas in the existential approach. First is that the existential theory states that people are capable of self-awareness and making decisions about their lives. So those are ideas that you should be coming to associate with the with humanism. The idea we've talked about, that people are capable of making decisions about their lives. That's one element of humanism. We each seek to have and to know our own identity, but also to be connected with others. And this is another idea that will be very clear in both the existential approach and the Gestalt approach, that we are trying to and must understand ourselves and live our own lives, but we also must live effectively with others. We must be connected with others. The existential approach rejected and rejects the idea of determinism, which we've talked about in the psychoanalytic theory, and we will talk about in behaviorism. So they reject that idea that we are determined by forces in the environment or forces in our subconscious. And you'll see when I tell you a little bit about Viktor Frankl, how clearly that idea that we are determined by forces outside our control just doesn't make sense from the perspective of this theory. The existential approach emphasizes humans' freedoms to choose what to make of our circumstances. Okay, so we are faced with circumstances, we are always free to choose how to respond. With this freedom comes responsibility, and with responsibility comes anxiety. So those are key ideas that we'll also be talking more about. We have choice, and because we have choice, we have freedom. Because we have freedom, we have responsibility. Because we have responsibility, we have anxiety. Key concept: we are the authors of our lives. We are not victims of circumstances. And because we choose our attitude in any situation, we are not victims, but we are the authors of our lives. And Viktor Frankl, I believe it was Viktor Frankl who referred to this idea as no matter how powerless we feel in the circumstances, no matter how many of our freedoms are taken away, we always have the last freedom, the last of human freedoms, which is our choice in how we respond. And that one freedom cannot be taken away. So the last of human freedoms are our choice in how we, our attitude and how we respond to our circumstances. So the aims in the existential therapy are to get clients to reflect on their lives, to get clients to recognize that they have freedom and to identify the range of alternatives. A lot of times clients feel like they are trapped and have limited alternatives, so it's a process of exploring the alternatives that are available and making effective choices among the alternatives that we have. So I mentioned Viktor Frankl already, who is the author of a very famous book called Man's Search for Meaning. And Viktor Frankl was another Viennese, originally a physician, eventually became a psychiatrist, and very influenced initially by the psychoanalytic and Freud's approach, and then later influenced and found that his own ideas were more closely aligned with Alfred Adler's, and then spent his life and career developing his own theory and therapies in the existential perspective. Developed and started talking about logotherapy, which you can think of as essentially a form of existential therapy. But Viktor Frankl was a lot of overlap in the lives of Viktor Frankl, Freud, and Adler. As I said, he was from Vienna. Like Freud, he started some free counseling clinics in Vienna prior to World War II, prior to the rise of the Nazis. But Viktor Frankl and members of his family were in the held in the concentration camps. And so a lot of what he talks about in his Man's Search for Meaning has to do with the experience of literally having every freedom taken away, but that idea that we always have that ultimate last freedom, which is our choice in how we respond to our circumstances, our response. So it's a fascinating book, and I highly recommend that whether you see yourself as an existential therapist or not, that you read Viktor Frankl's Man's Search for Meaning. Rollo May, an American therapist and theorist, also associated with the existential approach to psychotherapy, also wrote several books, and we'll talk about some of his ideas. Man's Search for Himself, and we'll see some of his ideas today. And then Irvin Yalom, well-known name. We'll talk about his ideas of the 4 central concerns in existential psychotherapy, and the 4 existential concerns of death, freedom, isolation, and meaninglessness. We're going to get to those in just a minute. But also author of many books, and I'm sure you've seen his name if you've had any coursework or association with group therapy as well. So those are the key figures in the some of the key figures in the existential theory. So let's talk about some of these key principles. First one we're going to talk about is the idea of meaning, and from the existential perspective, people have a deep-seated striving for higher and ultimate meaning in life. Okay, Viktor Frankl said that, suggested that the search for meaning, and not some of these other ideas we've talked about, like seeking pleasure and avoiding pain, power of various sorts. Not those, but actually meaning, and the search for meaning is the most urgent question with which humans struggle. So the motivation, what we are looking for is this understanding of the meaning of our lives, and that striving for a higher meaning is the unique experience of existence and the driving force of human nature. So again, this idea that we are all searching for a common goal. In this perspective, it is meaning, but we all do that individually and in our own unique way. The second key principle, key idea we want to talk about is anxiety. And I mentioned the 4 inescapable concerns of human existence: death, freedom, isolation, and meaningless. And the idea is that every human does and has always had to deal with these 4 inescapable concerns, fundamental questions of our existence. And we're going to talk about these individually in just a minute, and the ways that people can and do respond to these, and how that our responses can lead to problems in living our lives. So the question here is, how do people choose to react to these inescapable concerns? And we're going to come right back to those in a minute. I want to talk first about this other idea. We've mentioned Principle 3, the idea of freedom and responsibility. We are responsible for developing ourselves and our nature. Okay, so we choose, we come into this world, we live in this world, we are responsible for and capable of developing ourselves, determining our own nature, for determining meaning in our lives, what's it all about for us from our perspective, and for facing the reality of meaninglessness, the idea that there may be no higher meaning. So we are free to do this, and we've talked about this idea: when you have freedom, you have responsibility. So key concepts here. Moving into these 4 inescapable concerns and potential responses. The first one that Yalom identified we're going to talk about is freedom. The anguish and potential glory of humankind is that we are free to choose our existence. Okay? We are free to choose our lives. There is no predetermined nature that defines us, but in the context of our lives, we determine our own nature. All right? Powerful idea. We decide. We don't have this put into us by others, by our environment, but we individually have the freedom to choose who we are and our human nature, who we're going to be in this world. With this freedom comes anxiety and the need to order ourselves, apply self-order, and take responsibility for our lives. Unhealthy responses to this massive concern of what am I going to do with my life, who am I going to be. An unhealthy response to this is to say, I'm going to choose to not take responsibility for determining who I'm going to be. I'm going to give that responsibility to others. So in effect, we give up our responsibility and we do allow others to decide who we are, whether that be family members or people in our social network or cult leaders or so on and so on. Okay, but basically giving up that freedom to others. Second concern is the idea, the awareness that we are all going to die one day, that our lives will end. And again, we can have from an existential perspective, we can have a healthy response and an unhealthy response. The healthy response might be, for example, to live life to the fullest, to choose to live the best life we can, live in the present, to develop social relationships, to fall in love, to have intimate relationships, to participate and develop social interest, to share, and basically to live our lives and to have the courage to be the people that we can be. So those would all be ideas associated with a healthy response to this death awareness. An unhealthy response, unhealthy responses include basically come from this tremendous fear that people have about the idea that our lives are going to end. So some people might develop ideas like that we are special and unique and that our lives will not end, that we will be immortal, invulnerable, particularly seen among people in the late teenage, early 20 years, for example. This perspective that life will go on forever. Narcissism, self-love, self-focus, entirely on oneself, giving up responsibility, or spending your time worrying about all the things that you've done wrong, all the things that you wish you could have done differently or would have done differently. So when you think about dying, you think about how you've wasted your life, basically. So all those sorts of responses tend to create problems for us, tend to be unhealthy, and might be issues that we would talk about from an existential perspective and working in therapy. Third idea is that we are born alone, we come into this world alone, and we die alone. Again, there are healthy and unhealthy responses to this idea. One healthy response is that we take responsibility for our own lives. Again, we accept that we are alone and that others are not going to be able to, or we don't want others to determine our lives, but we want to take responsibility for our own lives, develop ourselves, love ourselves, develop relationships with others that include healthy boundaries, but that also allow us to have healthy and meaningful relationships, understanding that although we are indeed alone, we come into the world alone, we leave the world alone, but we are also related. So we can have meaningful, happy, healthy relationships and participate with others while we are living. Unhealthy responses to this concern would be basically resisting it, rejecting it, and trying to fight it by fusing or trying to become one with another. So completely trying to reject this idea that we are alone by trying to fuse with another person or another group. And you might think here again about cult membership, for example. People who give their lives to another group, they take on the perspective of the group and try to fuse or become one with the group. Doesn't have to be cult membership. There are people who join into relationships with another person along these same lines, but basically giving your life over to another and trying to become one with somebody else because you're so concerned with and afraid of or uncomfortable with this idea of being alone. I think we're on the fourth one here, is this idea of meaninglessness. Okay, it's this idea that there may be no higher order meaning, that there isn't really a sort of overriding structure in to life, and our search for meaning may ultimately lead us to realize that there is no sort of plan or path, but we're making this up as we go along. So a healthy response to this awareness would be that we basically we accept and are okay with and even celebrate the idea that we create our own meaning, that we establish our own values about what life and existence mean. So we find meaning by finding a purpose, becoming involved with others, creating, participating, creating meaning in life, and viewing that experience as an adventure. Unhealthy responses include feeling worthless, feeling like there is no direction, no purpose, putting off living, seeking meaning in self-centered ways rather than participatory or cooperative ways. If there is no meaning, then I will make meaning by taking care of myself and doing what I want and getting what I can out of this life. All right. Those would be some of the examples of the unhealthy response to this idea. So those are the key ideas, and in terms of the counseling process, the purpose would be, purposes include restoring in clients a sense of freedom, an understanding of freedom, that they have freedom in making choices, and also that idea of personal responsibility. We have freedom to make choices, and we have the responsibility to make choices that allow us to discover meaning, allow us to participate and live to our fullest potential. Another purpose is to help clients discover what they are doing, the choices that they are making, help them think about the choices as choices, make them mindful and aware that they are actually, whether they are aware of it or not, they are actually making choices. And maybe some of the problems that they came in to talk to you about or that they're experiencing in their lives are actually not forces outside of their control, but are resulting from choices that they are making. And then the third idea, helping and supporting the client in accepting the responsibility to face anxiety, to use their creativity to bring order out of chaos. So to accept the responsibility, and develop order in their lives. The characteristics of the counseling relationship in this perspective, it would be a present-centered discussion. You wouldn't spend a lot of time, as for example in the psychoanalytic perspective, you would not spend time talking a lot about the past, what happened earlier in your life, except as the past may be a key to understanding the present, the client's meaning, but you would not focus on the past, you would focus on what's happening in the present, in the client's life. It would be a phenomenological perspective, again, so you would be getting to know the client and understanding the client in terms of his or her own worldview. Immediacy, the idea of actually, as we're sitting here talking, here and now, what is happening, what are you feeling, what are you experiencing. So very much in the present, in the literally in the present of our conversation that we're having right here and right now. How are you responding to these to this discussion that we're having, this conversation? Authenticity refers to the idea that the counselor is basically has hopefully dealt with or is continuing to deal with, but has dealt with in a healthy way these issues of, for example, meaninglessness and the other issues that we talked about. The counselor is self-aware. In other words, is aware that we are all dealing with these issues, but is a authentic and real person, also struggling with the issues, not acting like they have all the answers, but being willing to be a real person dealing with the issues, him or herself, and willing to share him or herself with the client. So I said that the existential approach, we don't really think about a lot of techniques associated with this perspective. As I said, it's sort of an overlying idea that you might work from and then apply techniques from other perspectives, especially if you're working in a rehab counseling perspective. For example, you may use some Gestalt techniques, you may use some cognitive or behavioral techniques, but the techniques that we do talk about from an existential perspective include the idea of immediacy, so working with the client right now in the here and now in this counseling session. Being a mirror, so reflecting what you are seeing and hearing, so that the purpose of that sort of reflection is, of course, to develop insight in the client, to help them see and understand the choices that they are making, helping the client to evaluate their values and actions. So we are reflecting, we are asking questions and making statements that help the client to become aware that they are making choices, help the client to evaluate the choices, the values, and then sometimes confronting. So pointing out when the client is avoiding, pointing out contradictions, pointing out, helping the client to see that they are actually not making a choice, they are not deciding something that they want or need to decide, helping them to confront that decision, or confronting them with the idea that they are not acting responsibility, they're not using that freedom effectively, and then encouraging the client to take action.